From the studios of Boise State Public Radio News, I'm Samantha Wright, filling in for Jim Gaudet, and this is Idaho Matters. Measles, invasive strep, medical debt, bird flu. Those are just some of our top health headlines today, and the ones we're going to jump into because it's Wednesday, and that means it's time for our Doctor Roundtable with Dr. David Pate. He's the former CEO of St. Luke's Health System. He's the co-author of the book, Preparing for the Next Global Outbreak. Dr. Pate, good afternoon.
Hi, Samantha.
If you have a public health question, send it now. An email, idahomatters@boisestate.edu. Let's jump in. I did a little looking around this morning, as I said on the health news, Dr. Pate, and I saw, I don't know how many headlines about measles, new cases, first case in years in whatever state. It looks really bad. Can you give us an update on measles? Where is it spreading? What's going on?
Yes, this is very bad indeed. And in large part because of the fact that we had once eliminated measles from the United States back in 2000. So here we are 25 years later, and we are having one of the largest outbreaks we've had since we've eliminated it. And sadly, deaths of young, healthy children. So at this point, the confirmed cases exceed 600 in the United States, and I believe it's a hair over 500 in the state of Texas, where we believe the biggest outbreak emerged. And measles has now been confirmed in 22 states. And so this is quite extensive. I suspect we are greatly undercounting cases. I suspect the true number of cases is in the thousands. And I have basically, based on looking at other outbreaks and what we could learn from those, my guess is we will not have this contained this calendar year. It is probably going to take into 2026 for us to get this under complete control, is my guess. That's sad.
It's very sad. And, I was looking back. We've been talking, you and Gemma especially have been talking about measles, I don't know how many times on the Doctors Roundtable this year. Is there anything new with these cases, or is this just a case of, you've got more cases out there and then more people catch it because there are more people with it? You got a penny and you double it, and pretty soon at the end of the month, you got thousands of cases of measles. Is that basically what's going on?
Yes, basically. There is one twist. So what we are seeing would not have been surprising to what people who lived in the United States prior to the advent of the vaccines would have observed, that we would have lots of cases of measles and that you're going to have some children die of it. What is different this time is first, is the amount of disinformation. So I think that is greatly undermining our efforts. There are still myths about the MMR vaccine being spread that have been debunked for decades now, and that we absolutely can prove are wrong. But yet people believe it. And then the added twist, which I never contemplated seeing in my lifetime, but here we are, is that the leaders of our federal government and in some states as well, that are responsible for public health are actually the ones spreading it. In fact, not only have children been harmed because parents have been scared into not vaccinating their children, we have now had children, particularly in Texas, where the Secretary of Health made a big push for vitamin A, We have children hospitalized that not only are having to be treated for severe measles, but also for vitamin A intoxication. So that is a bit different as well.
Okay, we did get a new question in about the measles vaccine. We've looked a couple of times at questions from people asking, what do you do if you had the vaccine in the 60s? Should you get another one? But I'm not sure we've covered this one. This is from Janice. And Janice says, I had measles as a child, so she had measles, but didn't have the active vaccine. As I previously had measles, should I pursue the current vaccine? She also says she loves you, Dr. Pate. But what should
Oh,
Janice do?
well, I love Janice. So, Janice, as long as there's nothing unusual about your medical history, for example, that you aren't undergoing cancer treatment or being treated with immunosuppressive medications for some reason, no, you're good. You and I, who both had measles,
Ugh.
absent any of these circumstances that would weaken our immune systems, we're protected for life. So you're good and no need to worry.
So we've said this before, but what's the answer to stopping the spread? Vaccines? Vaccine?
There is one way to stop the spread, and it is not vitamin A, it's not cod liver oil, and it's not the assortment of various supplements and so forth that some people are grifting on. It is the MMR vaccine. If you have not had the measles in the past or your child hasn't and you are not vaccinated, please get an MMR vaccine as soon as you can. And the reason is the spread of measles is not, sadly, is not just a US phenomenon. This is happening. Toronto, Canada is having a huge outbreak.
Mm.
Many countries around the world are having outbreaks. I'm hearing almost every day of people that had measles but wasn't detected yet that have been through our various airports. The chances that you're going to be exposed to measles is only increasing. And as I said, I think we've very much underestimated the extent of this current outbreak. It is probably far more prevalent. It's probably going to spread throughout the country. So get the MMR vaccine. That is the only way to spread this. Let me reiterate something that we said before. Measles is the most contagious virus that causes human disease that we know of.
Oh,
And that means that what we see with measles is that if someone is infected, on average, they infect another 12 to 18 people
oh my gosh.
if those people are not protected. And if you had people gathered in a room with somebody with measles, you of those that are susceptible, you would expect 90% of them would get infected from just that exposure. Also, the measles virus has been shown to be able to survive in the air for an hour or more. So even if you enter into a room that someone with measles has already left that was infectious, you could still get infected without even realizing you were exposed to somebody. This is nothing to play around with. And yes, most people will recover from measles fine. The problem is is that there are many complications. We cannot predict who are the people that are going to suffer those complications. Some of those complications are deadly, and we know that measles infection weakens your immune system for several years after you have measles because we see that the measles virus infects immune cells, and we see that death rates among children, even after they've recovered from measles, are still higher in those next few years. So this isn't something to mess around with. The vaccine is very safe. It is highly effective. One dose of MMR vaccine, 93% effective for life. A second dose, 97% effective for life.
I'm really depressed now. Let's talk about something else. How about invasive strep? Because it's lunchtime. We always like to talk about really nasty stuff while people are eating. It's a little bit of a
And this will be less depressing.
Yeah, but that's kind of a warning for people. We're not going to get too weird, but just in case, we've got a study out that says there's been a jump in invasive strep. So, what is invasive strep, and how is it different from regular old strep?
Right. So most people are familiar with the concept of strep throat, especially if you've had kids. They get a fever, they get a sore throat, the tonsils are infected. They go in, they get a strep test, it's positive. The doctor gives you some antibiotics, and the kid is no longer infectious after they've been on the antibiotics 24 hours, and they get better very, very quickly. That is not invasive strep. What invasive strep is when that strep bacteria gets into places that we don't normally see bacteria. So we always see bacteria in the throat. That's not a shocker. But with invasive strep, it can get into the underlying tissues under the skin. It can get into your abdominal cavity. It can get into your bloodstream. It can cause all kinds of havoc and is far more serious disease.
Well, how serious is it? How bad can it get? There's something I read in this study about necrotizing fasciitis. That sounds like fun.
You do not want to have that. I have treated patients with it. It is a very nasty infection. So a lot of people, a lot of listeners will probably be familiar with cellulitis, where perhaps you've gotten a bug bite or perhaps you've gotten some other nick in the skin. You got a superficial infection where you had some redness spreading out from where the part was that you got your skin pricked or bitten, and it gets red, it gets hot, and but then that's easily treated and you recover very quickly. With necrotizing fasciitis, what we are talking about is deep layers under that skin. So cellulitis is in the skin, but the fasciitis is down below the skin into the layer where your subcutaneous fat is and your muscles are. And then the necrotizing part of the phrase means that it just is killing the tissues. It basically rots and it extends very, very quickly. The worst cases I've seen are in diabetics, who are most of all people to get a special form of this, where it actually starts in your perineal area, which, if you don't know what that is the area for men between your scrotum and your anus. For women, between your vagina and your anus. It starts there and it marches up into your abdomen. And so necrotizing fasciitis is going to make you extremely sick. You will become fast heart rate, fever, low blood pressure. It's deadly. It can be deadly even by the time you recognize it to the time you get to the hospital. It requires extensive debridement in the operating room oftentimes. It requires IV antibiotics. It can certainly kill people. It is serious. And we have seen several times now during the pandemic where the cases of invasive strep have increased, as they are now again. And so we have seen this, and it is much more than we've seen in the years prior to the pandemic.
So why are these cases going up? And I should point out, we're going to put the study online when we put this up on our website. But in the study, they only looked at 10 states. So the numbers they're talking about are much more than that, because we have more than 10 states. And so obviously people are getting sick in more than that. So this is pretty big. Why is it spreading like this?
Well, that's an excellent question. And the reason it's only 10 states is not all states record and report these infections. But to answer your question, why is it happening? It's probably not a single reason. One thought is that with all the recurrent COVID infections and other infections, what we do know is that some of the cells of your immune system that protect you from strep infection that are in the nose and nasal passages, those cells almost get wiped out with the COVID infection. And so sometimes we can see this emerge in that setting. We've also seen bacterial infections increase with or right after influenza, and as I already mentioned earlier, after measles. So that may be the cause or a contributing factor in some people. In other cases, people who we're seeing a greater presence of this bacteria on the skin. That may be happening to people that may be higher risk for carrying the bacteria on their skin, particularly those that are very obese or have diabetes may be particularly at risk. Other things are IV drug abuse. When you get bit by an insect, that opens the skin, which is a protective barrier, and it allows bacteria in. But the same thing can happen with injecting IV drugs. You break the skin, the bacteria on the skin can get in that way, or the bacteria may be contained on a non-sterile needle. So that could happen. We also tend to see a higher risk for these infections in areas where there's a lot of crowding. We see it. We can see it in homeless shelters. There's a lot of probably many reasons why we're seeing this. But the answer to your question is not entirely known.
Okay, so if there's a lot of reasons why, then there probably isn't a catch-all to try and stop this.
No, the key is that good hygiene and making sure that people are aware that you do carry bacteria on your skin, and that bacteria is generally harmless to you as long as your skin remains intact. So anytime that you have a fall, scrape, bite, other kind of cut to your skin, you need to observe those carefully. And the same thing on your kids. Observe those carefully. If they are rapidly getting swollen, redness extending from them, and especially if you see red lines running up from the leg or up the arm, those are things to get in touch with your doctor right away about. Generally with mild skin infections or even cellulitis, we don't generally see fever. If you're seeing a significant fever, that's a good reason to call. Any of these things, just be on the lookout, and also just realize that your threshold for getting medical attention in light of these potential problems should probably be lowered.
Dr. Pate, there's a news story out. It's from KFF News. It's about a deal that will wipe out more than $30 billion, that's with a B, in medical debt. Now, I sat up and paid attention when I saw this because pretty much everyone who goes to the doctor, even if you have insurance, you have to pay something. And all it takes is a broken leg or a hospital stay to really rack up that debt. This is going to affect or help 20 million people with medical debt. Am I going to be one of them?
Well, possibly. I think this is a wonderful thing that this organization is doing. There are so many people that are saddled with medical debt, and it's a huge hardship on families. I know when I was growing up, my brother had some significant issues that led to overwhelming bills. And this is before we had the Affordable Care Act. And I remember my parents struggling through that to get those debts paid off. And there's many people that just don't have a way of paying those debts off.
It's crazy. I've never heard of this group. It's called Undo Medical Debt. Have you heard of this before? Have you heard of something like this before?
No, I haven't. Of course, it's very common for there to be debt collection agencies and for those agencies to sell their debt to other companies. So that I'm very, very familiar with. But this is the first instance that I've been aware of a company that actually pays off the medical debt for individuals. And I think it's just fantastic.
Okay, the story, and we'll put it up online as well, says 100 million people in America have medical debt. And when I looked at the World-O-Meter this morning, it said there were 346,851,495 people currently, about 10 o'clock this morning, in the U.S. So if my math is right, one in every 3.4 people around the country has medical debt. That is a lot. I'm guessing, have seen this. You're a former CEO of a big hospital system. I'm guessing you've seen how debt can affect the care system.
Oh, definitely. Now, the good news is that it is far less of an issue since the Affordable Care Act, although that didn't get rid of it either completely. Because I remember the days when children had to go off their parents' health plans, and but they had not. Maybe they were in school, they had not gotten a job. Most people got insurance through their job, and then I often dealt with heartbreaking situations where here you now have a young person in their 20s with an unexpected pregnancy that has problems. It's going to be very, very expensive. Or maybe I've had instances where they have developed cancer and now they're uninsured. That is a real problem. The other thing that is a real problem for debt is those states that did not expand Medicaid, or those states that are looking to cut back on the Medicaid expansion, because that affects a lot of people. And the Medicaid will cover their expenses, and they generally aren't in this debt group. But those that cannot qualify for Medicaid often are, that don't have an access otherwise to insurance. The other things are that there are many hospitals, like the ones I ran, that are not for profit and tax exempt, where we gave charity care. But remember, there's a lot of hospitals that are for profit, and they may or may not offer charity assistance. And therefore, someone may be going to the hospital thinking it will get covered or have an unexpected problem, and those bills can really mount up. Or people that take the risk of some not very good health insurance plans. Sometimes some of the religious association health plans, or sometimes there's some other specialized plans for certain groups of people, but they're not well funded, not capitalized, and they may not cover most of the expenses. So there's still a lot of reasons that people can get into debt.
Well, there was a scary statistic from the story from KFF News, and it said Americans borrowed an estimated $74 billion to pay for health care. And that's borrowed, not, you paid it and then tried to make it up somewhere else. So I'm not sure that this group, undue medical debt, is going to be able to fix all of the debt. Is there a solution to this?
Well, I don't think it will be able to solve all the problem. And there are some potential solutions, but it would require the federal government embarking on them. And unfortunately, we're going the other way. And what I mean by that is, for example, right now with the tariffs, and I'm certainly not an expert to be able to weigh in on the pros and cons of these tariffs and whether it's good policy. But let me just mention that the president has told us that there are going to be tariffs launched against pharmaceutical companies. Now, we have to realize that the minority of prescription medications are made in the United States, and the minority of generic and over-the-counter medications are made in the United States. What that means is drug costs will go up, and drugs are an area where a lot of insurance companies have a lot of carve-outs where you either have high copays or you have not coverage at all. And of course, we saw what the relief was to people on insulin, which they need to save their lives from diabetes. And it was a godsend to these people when the government capped those costs at $35. Now the government is talking about not having those caps. We pay more for drugs in this country than almost any other country that I can think of. And the problem is the tariffs will increase those costs, which for many of these drugs are already unaffordable. And I am concerned about the effect of the tariffs on hospital costs, because most of the hospital supplies we get, as we saw with the pandemic, are for supplies that aren't made in the United States, and so all those costs will go up. And obviously, hospitals then have to pass those costs on to consumers, and this could make this problem a whole lot worse.
Edith in Ketchum wrote, "My 19-year-old son in college in Denver is going to El Salvador on a surf trip at a tiny resort. I'm very jealous. Does he need a typhoid shot?" she asks. "And if he gets it on a Thursday and travels on a Friday, is that okay? And is there a live vaccine or a not live vaccine?" Dr. Pate, you're up.
Your answers are yes, no, and yes. So the first thing is if he's going to El Salvador and engaging in the activities you're talking about and going to be in one of the more remote places, I think typhoid vaccine would be well advised. So good for you for identifying that. The no answer is to if he takes it on Thursday for a Friday trip, is he good? No. So let me go to your last question about the types of vaccines, and then I'll explain the timing. So the answer is yes. There is both an inactivated vaccine, which is an injection, and there is an active or live vaccine, which is some capsules that have to be taken. I believe it, if my memory serves me, is 4 capsules every other day. But the injection needs to be completed 2 weeks before travel, and the oral has to be completed a week before travel. But to get to the end of the oral, you would have had to start more than a week before that. So basically, for both of these, you need at least a 2-week head start. So if you still have some time, get in touch with your son, let him know, yes, typhoid fever, but no, don't wait till Thursday before you leave. Get started on your program right now.
Okay. This one is a little lengthy. Stay with me. Sunny and Haley wrote, I believe this was yesterday, "One of my dogs had a dead bird in my backyard this morning. The dog actually had the bird in its mouth. Should I take it somewhere for testing?" She says, "I have chickens and my neighbor has chickens." Sunny left a call to South Central Public Health, Bellevue, left a message, but they were closed. That's why she wrote to us. And then sent us an update. Sunny ended up talking to South Central Public Health, Idaho Fish and Game, and Jerome, and 2 veterinarians. And basically they all said there's no risk with songbirds transmitting bird flu to a dog, and not to worry about the dead bird unless there are massive bird die-offs. So here's the question from Sunny. She says, "I am not overly neurotic, but I believe in being proactive if I am concerned about personal or public health. I think I've heard Dr. Pate several times express frustration with health authorities' slow action on dealing with recent public health issues. If Dr. Pate says I'm overreacting, I would be relieved to know that." And Sunny says, "I'd like to see bird flu stopped before we lose all our pet chickens and eggs." So, Dr. Pate, a lot to look there, not a lot of time left. Let's start with bird flu. What do you do if you find a dead bird in your yard? What's the best step?
So, Sonny, first, a virtual hug over the airwaves to you. You're my kind of person. I love that. So, if you find a dead bird in your yard or property, what I would suggest is that you utilize. I would personally put on gloves. You don't have to, but if you're going to pick it up, use the trash bag, much like you would for picking up dog poop if you're walking dogs, and collect the bird in it, tie it off, put it in the trash can. I, for one, would also wear a mask because this is an influenza virus.
Mm.
So I would use gloves and a mask personally. That could be overkill, but at least don't touch it directly. Gather it in the bag. You can dispose of it in the trash unless you can find a place that does want to do the testing on the bird. And then after disposing it, I would wash my hands thoroughly with soap and water. And so good for you.
Is Sunny overreacting or just being cautious?
Not at all. It's as if Sonny and I are brother and sister. I'd have done the same thing. And I'm disappointed, frankly, in the guidance given you. I don't think it is technically perfectly correct.
So I think this is really good. And we've talked about, dead birds in the yard before. What should we do? And I think there is this guidance that says, not to worry unless there's a mass die-off in your area. But then obviously Sonny's saying, well, why not report the dead birds and get them tested? I'm guessing our system can't handle that, to test every bird that somebody finds.
Well, I think that's true. Of course, birds don't have long lives, and so birds are going to die, and there's some are going to die of natural causes. But the problem is you're not going to find what you're not looking for, and the problem is that we have been repeatedly surprised over the last 2.5 years of all the different species that we had no idea could be infected with avian influenza, which are. And so, that certainty that they conveyed to Sonny that, oh, no, you don't have to worry about a songbird. Well, that may be correct because we haven't identified it in songbirds. The highest risk birds that we know get infected are waterfowl and raptors. However, we do know that grackles can get the infection. And the problem is if we're not looking, over 200 species of birds have been infected. So I don't know that of any cases of songbirds, but if we're not testing, how will we know? And they're birds, and the avian influenza, in the avian in that stands for birds. So I wouldn't be so surprised and so confident in saying that. If I'd asked people 2 years ago, could large herds of cattle get infected with avian influenza? They'd tell me, absolutely not. You're crazy. And yet we have hundreds of herds of cattle infected now. So good for you, Sonny.
Okay. Well, Dr. Pate, as always, you are a light in the darkness. We appreciate you so much. Thank you for answering some of these questions today.
Well, thank you, Samantha.
We've been speaking with Dr. David Pate, former CEO of St. Luke's Health System. He's the co-author of the book, Preparing for the Next Global Outbreak. It's a great read, by the way. If you have a public health question, send it. Idaho Matters at boisestate.edu. We'll answer it next week. Dr. Pate will be back on Wednesday.
And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.